Dr. Kobayashi here with the Echo Men's Clinic. Today we're going to talk about how to deliver your testosterone injections to yourself. You have a few different options for needles, okay? Needle gauges, the higher the number, the smaller the needle. So 30 gauge is very small, okay? And then 18 gauge, like this, is very big. So you could draw up with a needle as small as 30 gauge. This is an insulin syringe, and many of you will be giving yourself testosterone with this. It takes a very long time for the oil to get in here with such a small needle. Okay, here I have some testosterone. Let's say I'm going to try to draw up 10 units. I'm going to pierce it, inject 10 units of air, and I'm just going to pull back on the plunger, okay? And I'm going to wait for the oil to slowly get into the syringe. You can see that it is very slow because it is a 31 gauge needle. Okay, see, so right now I have about 7 units, so that gives you an idea of how to draw it up with that. Now, if you were going to administer this yourself, you'd clean off a little area with alcohol swab, and you would jab it in there, and you would have to slowly depress the plunger. It will take a while for all the oil to get in because it's such a small needle. You could also do this intramuscularly into the thigh or the shoulder. In this case, the needle probably is not big enough to get into the muscle, and it would be subcutaneous. Another option you could do is you could use one of these syringes in which you need to attach a needle. And what you could do is you could draw up with a big needle like the 18 gauge and use this to draw up. Let's say you're doing 0.2. See, that went out really quickly. I like to suck it back after I have the needle because you do get a little bit of testosterone out of the needle. And then you'd use a different needle to inject. In this case, I have a 25 gauge needle. You would push it till it gets the air out, and then you can use this for injection into the quad, into the shoulder, or into the buttock. Alright, so hopefully now you know how to inject, and if you have any questions about it, you can always ask me.